So good evening, everyone. I am Elaine Vivens, the coordinator for the Children's Oral Health Coalition, and I want to take this opportunity to say thank you and welcome to our second in a series of Growing Healthy Kids from Pregnancy and Beyond, What Nobody Tells You. Today, we're going to talk about don't put off prenatal care, medical or dental. But I also wanted to share with you that and just give you some key highlights about the Children's Oral Health Coalition. We are here to improve the oral health of children throughout the Tarrant County and the surrounding areas. And we do that through collaboration with over 50 coalition members. Our goal with this and the target audience for us is birth through third grade. And you're probably wondering, how did we get involved with pregnant teens and women? Well, in order to reach that birth, that baby, we need to reach the mom and the dads and everybody that supports them as well, because they're all involved with that baby on some level. But we are primarily focused in 4 different focus areas, and we do awareness, prevention, education, and advocacy. When we talk about awareness, what we're really looking at is the oral health messages that get out there that we're putting out to people to bring up awareness about oral health. We have a dental and infant brochure. The dental brochure is a low, no cost dental clinics that's available in the community. We started out with that primarily targeting for children's clinics with children, but we've now expanded it, and it includes information for parents as well. And we also have a new 5210 infant and toddler brochure that talks about the amount of screen time, eating healthy, cutting out sugary drinks, exercising. I know, but starting early, you start them on the path of doing all those habits, healthy habits that you want them to have. From the prevention side, we do an annual Wild About Smile Kid Assembly and Distribution event in February every year as part of the Children's Dental Health Month. We also do have a school screening committee that's comprised of 5 coalition members that go out in the community to do screenings at the schools. We also do screenings of pregnant teens at schools. We started, well, I guess I could say this year, a little bit before COVID hit, in Arlington ISD, and we're hoping to be able to move that to Fort Worth ISD in the coming year. From an education focus, we do our Train the Trainer for community professionals, and that is taught by a dentist and/or dental hygienist. And because of COVID, we do now have 2 sessions, session 1 and session 2. Session 1 is primarily focused on the pregnant mom. Session 2 is more focused on the children. And those are available for anybody that's interested, especially if you have a group that you work with and want to teach them about oral health. We also have what we call our Ask the Docs series, where we're targeting medical and dental providers to raise awareness and education with them about the coordinated care for the pregnant teens and women. And also a part of that is that age 1 dental visit. We also do virtual monthly series, parent education. And what you're attending today is actually our second one in the series that we started, and we just started that this year. And I will say thanks to COVID. So that's a positive thing that has come from COVID. And we also have our what we call oral health ambassadors. So once you attend Train the Trainer, you become an oral health ambassador who can now help us not only provide education to the families you serve, but through other avenues in the community, and advocate for oral health on behalf of these pregnant women and young children. So from an advocacy standpoint, change really begins at the organizational level. And we've seen that in several different ways with the organizations that we work with through the coordinated care for pregnant teens, but we've also seen it with Train the Trainer, working with organizations that have never provided oral health in their classroom, in a school setting, or even a daycare. And now they're doing that. So that's organizational change. And then access to care, we'll talk about that a little bit more as it relates to the pregnant teen and women here in just a little bit. But access to care is very important. And access to coverage, if you don't have the coverage, you really can't get care. And we use data to inform all the work that we're doing around awareness, prevention, education, and advocacy. So I also want to say thank you to our moderator and panelists that we have today. We have Dr. Tanya Fuquay, who is the Oral Health Director with the Center for Children's Health. We also have Dr. Andrea Palmer, who is our OB-GYN, and she's with Phenom. And I'm not sure if we have Dr. Chu yet. Again, we had some technical difficulties, so I'm not for sure if he was able to join us yet or not. So having done those introductions, what I'm going to do is turn it over to Dr. Fuquay. And Dr. Fuquay, I'd like for you just to share a little bit about who you are, what it is that you do. Tell us what prenatal care really is, and kind of talk about from the dental side of why it's important to not put off prenatal care.
Okay, thank you, Elaine. I sure will. So like Elaine said, I'm Dr. Tanya Fuquay, and I am a general dentist. However, I have two hats, multiple hats that I wear. Not only do I have a private practice where I treat patients of all ages, as well as run the oral health programming for under the Center for Children's Health for Cook Children. So I'm blessed to be able to be a little bit of everywhere, have my clinical skills and my clinical hat on, as well as get to be in the community and help from more of a systemic type level like this, you know, from a community care. So this is a huge issue that I'm so excited to be a part of and get to see. You know, for the longest time, conversations have been had with the Children's Oral Health Coalition is how do we prevent dental disease? How do we prevent these little ones from getting cavities? And one of the things that we've discovered over the years, and it's been seen over and over again and heard over and over again, is the fact that we are not getting to the children early enough. And in reality, when you look at it, it actually needs to start from when the baby is in the womb, when the baby is growing in mama's tummy, that things need to be discussed. Because as Dr. Palmer will tell y'all here shortly in a little bit, how important things happen during pregnancy. And that's not my forte, but my forte is about the teeth and how it impacts children, as well as how does that impact a pregnant mom. So why are we even connecting the dots here with medical and dental care? Why are we even talking about this? Well, because it's a huge issue. And unfortunately, people do not have the connection of the mouth, the oral cavity, to the rest of the body. And in fact, the mouth, the oral cavity, is the opening to the rest of our body. So it should be connected. And we're here to say that prenatal care should include not only the medical side of things through your OB-GYN, but it really also needs to make sure that dental care is included in that prenatal care. So the journey for a pregnant woman does, and we're going to talk why, a couple of reasons why. I will say that some people, there's myths that we will talk about a little bit later on. But here are some of the barriers of why people really don't maybe get to the dentist. Maybe insurance is an issue. Maybe financially, they do not have any kind of medical coverage. That can be a barrier. Confusion on whether they're enrolled or not with Medicaid. So with Medicaid, you know, if you're a pregnant female and you get pregnant and you did not have coverage, then you maybe can get coverage through that. So coverage, trying to figure that out can be a potential barrier, excuse me. The coordination of care. Sometimes our OB-GYNs and our physicians and our medical side of things get so focused on the health, the medical side of things, that we don't get the referrals to the dental, and vice versa. Sometimes if a pregnant female, or we find out someone's newly pregnant and they're sitting in our dental chair, maybe we're just assuming they are seeing an OB-GYN. And we really haven't had those kind of conversations. So we're here tonight to say, we want to open those conversations. We want our OB-GYNs, our medical side, talking with our dental and letting the community and the folks know that are pregnant, how important those conversations are. Disruption to access of care, limited window coverage for care sometimes, finding a dentist. Sometimes patients are on a particular insurance and they can't find a dentist who will see them because they are pregnant. And that's an issue. We want to make sure that we can get that patient, that mom, that pregnant female connected with a dental provider that feels comfortable treating a female while they are pregnant. So sometimes those are barriers right there within themselves of why someone isn't getting to dental care. So we'll go ahead and go on to the next slide and sit here and explain, but why is it so important? Why? Well, oral health is a mirrored image of your overall health, your body health. What's happening in your mouth is reflective of what's happening in your body. And your oral cavity, your mouth is an indicator of whether you do have good overall health. Overall health. Because again, the mouth is connected to the rest of the body and we need to mimic that. So if something is not right in your mouth, whether it's gingivitis, periodontal disease, cavities, which, let me just give a quick little scientific fact here. A cavity is in fact a bacterial infection. And when that bacteria goes crazy and you don't get that cavity taken care of with a filling, then it eventually turns into an abscess. And so people don't realize a cavity is a cavity is a cavity. A cavity is actually a bacterial infection. And should that be in your mouth going on? Probably not, because that bacteria then is being spread in the rest of your body. So that is really, really important to connect that. And here you will see as a diagram, really what is reflected in your mouth does in fact affect things that are happening in your body, from high blood pressure to dementia, to diabetes, to respiratory infections, obesity. If you're eating the improper things that are not allowing your body to be the healthiest it can be, those are probably the same foods that are causing problems in your mouth and causing cavities. So if we eat healthy for our body, our mouth is going to reflect that same thing. And then what we're here for tonight to talk about is pregnancy and how it affects that pregnancy. And believe it or not, pregnancy complications. And we'll let Dr. Palmer go into more detail with that, but it can be serious. So we want to make sure that we're helping a baby get started on the right foot before they're even born. And that starts with mom and her mouth and her oral health and how it impacts her overall health. So prenatal care is very, very important. And I just want to talk about a couple of little things, and then I'll let Dr. Palmer elaborate here in a second. But expected mothers that have poor oral health, cavities, gingivitis, periodontal disease, bleeding gums, that can increase that mom's chance of having a low birth weight baby and or delivering early. Neither one of those are good things that we want to see. Because the infection is happening in the mouth, that affects the hormone levels and things that are happening in the mom's body. Pregnant women consume sometimes some diets. This is a conversational thing here, so let's just talk about this. Women tend to eat and drink things they don't typically eat and drink when they're not pregnant. You've got cravings, you're eating late at night, you're snacking all day. That just causes problems to increase your chances of cavities or oral health problems. So unfortunately, those kinds of snackings, and then I want to say the other thing besides the snacking and eating maybe more sugary content things than you would have before. But unfortunately, then we also have the chance of mom getting that morning sickness and maybe starting to have acid reflux all the way to, unfortunately, throwing up. And so with that morning sickness or that throwing up or constant acidity in the mouth, that really not only impacts the mom and how she feels, but then what's going to happen in the mouth as well. So these are some visual signs that you can see of dental problems that happen. There can be women who've never had dental problems before they get pregnant, and all of a sudden they have little pregnancy sister tumors or red swollen gums. Maybe they've never ever had gingivitis before, and all of a sudden their gums are bleeding a lot. Well, that's a lot of your hormone levels going crazy that Dr. Palmer will explain more about. But things will start happening in the mouth that you didn't really see before you were pregnant. And so it's really, really important for that mom to be not only in tune, you know, they pay attention to their body, they pay attention to what's happening or swelling or other things, but they sometimes forget about really what's happening in the mouth. And that's part of the overall outcome of what's going to happen with mom as well as with baby. We'll go ahead and go to the next slide. So some of the things that we really want to make sure that we can do to prevent any kind of problems with mom giving birth too early, mom having low birth weight babies, mom not doing well, anything like that, is we need to make sure that we're not only seeing our OB-GYN on a regular basis for all those well visits, but we also want to make sure that we're brushing our teeth twice a day for 2 minutes at a time and seeing our dentist at the very least twice a year. Normally, you should see the dentist twice a year. If a mom is planning to get pregnant, maybe you're not pregnant yet, but you're planning to, make sure that your dental visit happens before that, so you can make sure your pregnancy gets started on the right foot from the get-go, from the beginning. Floss daily. We recommend everybody to floss once a day, every day. But definitely when you are pregnant, those hormone levels are crazy and you will tend to have a little more bleeding with the gum tissues. Using fluoride. We already talked about maybe throwing up a little bit more or having that reflux, having a lot of reflux just because of that weight, the pressure and all that good stuff. Making sure that we're rinsing the mouth out a lot with water, drinking a lot more water, making sure we're keeping that acidity out of the mouth, using some fluoride rinse at night before you go to bed. Make sure the brushing is done right before you go to bed, and then don't snack or eat or drink after that unless it's water. Eating healthy, drinking that water more throughout the day. If you're going to drink anything other than water, drink that with a meal. Definitely drink it with a meal, because that's when your saliva flow is going and it decreases your chance of cavities. If you're drinking that sugary drink during your chewing, when you're eating. Chewing gum, sugar-free gum, of course. We want to make sure it's sugar.
Why don't we go ahead and welcome you?
Okay.
And let me go ahead and get to your slides.
Sure.
And then that way you can go ahead and do your piece, and then Dr. Fuqua can come back and say the rest of what she had to say.
Okay.
And I'm sure it'll still come up through the conversation that y'all will have lately. So I don't think it's lost at all. So
no.
Go ahead.
Yeah, so my name's Dr. Andrea Palmer. I am an obstetrician gynecologist. I'm here in Fort Worth. I'm with Phenom Women's Care. We deliver our babies out of Baylor All Saints. And if you guys have been watching the news lately, you will know that we have had a record number of deliveries. We actually made Jimmy Fallon. He talked about us for our 108 babies in 91 hours that we delivered a few weeks back. So we have a very busy practice. Oh, Dr. Fuqua's back. Do you want to finish up?
You go right ahead.
Okay.
I will touch anything later in our conversational part.
Okay.
Thank you. So sorry, guys.
Yeah, you're fine. Okay, we can go over to the next slide. This is me and my gorgeous partners, if I do say so myself. I practice medicine with Dr. Sunny Glenn, Dr. Lisha Larson, Dr. Lori Atkins, Dr. Catherine Bevan, and Dr. Lauren Tabor. Many of these names, if you are a Fort Worth original, you might notice have been around for a really long time. Go ahead, next slide. We don't always look so fancy. This is us on a routine day. But we like to say that our practice is not just a practice in medicine, but a practice in humanity. And in addition to providing full scope obstetric care, we also provide GYN care with annual exams and help you tackle problematic bleeding, menopause, periods, birth control, all of those other kind of routine GYN things. And then our amazing staff is pictured over there on the right-hand side at our staff retreat this year. And, you know, we are really pretty passionate about Phenom, about why we're doing the things that we are doing and why we structure our practice and our approach to medicine the way that we do. First and foremost, we value connection and collaboration amongst ourselves and with our staff, but also with our patients. We have always felt and we always work to build trust between our patients and ourselves. That is such an integral part of, I think, a good physician-patient relationship. And our ultimate goal, of course, is to improve your health. As Dr. Fuqua mentioned, your dental health is, you know, kind of part and parcel to your overall health. When you talk about things like heart disease and diabetes, these translate again to pregnancy. Dr. Fuqua alluded to giving giving birth to low birth weight infants. Increased risk of preterm labor, preterm rupture of membranes, some association with preeclampsia in certain studies, and then all the dental changes that go along with just pregnancy in general. So our goal is always to improve your health head to toe with special focus on the pelvic region, of course. And we are ultimately here to empower our patients. We want to arm you with the information and the tools to make good decisions about your health and your body. And your pregnancy, and really, you know, anything that we can do to help out your mental health as well as your physical health. That's what we're here for. Go ahead. So since we're here talking about prenatal care, I thought I would just kind of briefly touch on kind of the routine things that we do throughout a course of prenatal care. Of course, you're going to have some lab work done throughout pregnancy, usually a few times. Our initial screening labs are things like your blood count and your blood type, infection testing for STDs, as well as we can offer genetic testing now to look at the health of your pregnancy, as well as test for certain genetic diseases that you may be a carrier for that potentially could pass on to baby. We do ultrasounds to look at the uterus, the baby, and the ovaries during pregnancy. In the first trimester, typically we're just there to kind of confirm how far along you are, set up a due date, make sure there's one baby, or if there's more than that, kind of quantify and qualify how that is. And then a second ultrasound in the middle of pregnancy, typically around 20 weeks, to evaluate baby's head to toe anatomy, looking at the brain structures all the way down to the toes. And then typically a third trimester ultrasound just to look for growth, fluid, make sure everything's kind of moving along as we would anticipate. The initial physical exam is done at your first visit. You know, where we do things like a pap smear if you're due for that, you know, listen to heart and lungs, do a breast check, all those other things. And then at the end of pregnancy, we have cervical checks for dilation, and of course, any time in between if you're having any problems. In that initial exam, pre-COVID, we were kind of doing a rudimentary dental exam. At this point, we are well, probably getting back away from it with the way that cases are going as of right now. But the frequency with which we see you in the first 28 weeks of pregnancy, we basically see you on a monthly basis. Starting in the third trimester, we start every 2-week visits. And then from 36 weeks, which is about 1 month before your due date, until the end of pregnancy, we see you every week. And of course, that can be adjusted based on, you know, patients' individual risks and concerns along the way. So who all is involved in OB care? This is going to vary a lot based on what kind of provider that you're seeing and what kind of institution you're at. I am an obstetrician. Obstetricians are either MDs or DOs who went to medical school and then residency to complete their training in OB-GYN. Along with that, in our community, we have a couple of groups of great certified nurse midwives. So certified nurse midwives are typically registered nurses who have gone on to get additional training in obstetrics and can deliver babies independently or with the supervision of a physician. These nurse midwives typically deliver at hospitals and or standalone birthing centers, and sometimes we'll have like a collaborative agreement with the physician or a physician of backup in case things like a C-section are needed. Certified nurse midwives can provide wonderful compassionate care, and again, they'll involve typically an OB-GYN as needed. Nurse practitioners, I have a fabulous nurse practitioner. Her name is Sarah. She's kind of new to our practice, but a lot of OB-GYNs will have nurse practitioners that you may see during your clinic visits, but necessarily won't be involved in like the delivery. And so that is part of a lot of care that you might receive at a physician's office. Doulas are typically not trained medical providers as such, but are birth support people. And so they typically would be somebody that the patient kind of engages on their own to be their support while they're still getting care from a midwife or a physician. And then your labor nurses, these are the heart and soul of our labor and delivery units. They're there with you through every contraction, through from the beginning to the end. And I will brag on our Baylor All Saints staff that I think that they're the best in town, but I'm probably a little biased on that. Go ahead, next slide. So Dr. Fuqua, do you want to start with some myth busting here?
I think so. I think this is a great time for, we really wanted to make sure, as Dr. Palmer and I've kind of talked a little bit before, is we really wanted to just have the opportunity to have a conversational and give you kind of a little overview of the importance and the why to this conversation of pregnant women and their oral health. So we wanted to make sure we took the opportunity to kind of bring up, we're going to start out by bringing up some of the myths that we hear, and then the myth versus the reality. The myths are what are people are hearing or what pregnant women are telling us as dentists or telling their OB-GYN. And is that a truth, or is that a reality actually, or is it just something you keep hearing over and over again? There's really nothing to it. So let's don't Google anything. Let's just have the opportunity to ask Dr. Palmer and myself, some of these common questions that we're hearing. So Elaine, I looked real quick. I did not see that Dr. Chu has jumped on the line. Unless I did see a cell phone with no name attached to it. Dr. Chu, if you are on, please jump in at any point in time. We'd love you to be a part of the conversation.
Okay, well, let's just continue
Yeah.
on with the myths and then go into our conversation with you and Dr. Palmer. And if you all participants, if you have questions, go ahead and start dropping them in the box and we'll pull them up.
Yeah.
And if you have a myth that you've heard that we may not get across, yes, by all means, because there's a lot.
Yes. So we'll get started because we're gonna give a few here to get us going. And then I think people's creative juices in their mind will start going and thinking, oh yeah, I remember I've heard this before. So pregnant women should avoid dental work and x-rays when they are pregnant. No, false. That is not correct.
Correct. And along with that, for an x-ray from your ankles to your teeth are all okay with proper shielding and proper precautions taking place. And so, you know, when you go to the dentist, they put the lead over your belly, whether you're pregnant or not. And so that abdominal shielding is going to protect baby. Dr. Fuqua, we could get into the intricacies of like how many, you know, grays or rads. It's very minimal radiation in general for dental x-rays. But certainly your routine dental x-rays are not any concern to a baby during pregnancy.
Exactly. Dr. Palmer is exactly right on that. And I want to say that typically dentists don't want to do x-rays anyway, just to get x-rays on a pregnant woman. They are on a pregnant female. They are going to take what x-rays are necessary. What is necessary to make sure that you are okay and that you're not going to have any problems during your pregnancy. They may be, you know, even less than what's normally done for a routine dental checkup. And they may, even if you're having a dental problem or a toothache, they may take an x-ray just of that one tooth, that one area, to make sure that things are okay with that. So really, let me just back up on that one to just give a little more information. So first trimester and third trimester are the ones we try to be a little more cautious with, right? Second trimester, OB-GYNs will say it all the time, that's the safest time, right? The second trimester is the second. That's when the dentists feel more comfortable to do. But dental treatment can be done anytime during the entire pregnancy, especially if it is something that is needed. Right. Because remember, if you're having a toothache or something's hurting or the decay is pretty big, we want to get that taken care of before that baby is born. And we want to make sure mom doesn't have a bunch of stuff happening that she's in pain that's going to increase her blood pressure, her pain threshold, stuff like that. So it really actually can cause more damage and more problems and issues if we don't go ahead and take care of the dental pain during pregnancy. Is that sound about right, Dr. Palmer?
Absolutely. And I mean, you know, even a few weeks ago, I had a patient who had a cavity and she didn't want to get it treated in pregnancy, and it developed into an abscess, and she had to get admitted to the hospital and get IV antibiotics and kind of go, you know, so it can really snowball, you know, if left unchecked. And so absolutely do the investigation that needs to be done, because without a healthy mom, we can't have a healthy baby.
Yeah, and prevention and early care is always better than going to that route. And like she just said, myth or reality, she just said that's a reality. That just happened the other day. Yeah. So we still see this day in and day out, that unfortunately people are not taking care of their oral health, and they're definitely worried about doing it when they're pregnant. So myth or reality, drinking diet soda is okay because it doesn't have sugar. Dr. Palmer, this one's yours.
So I come at this from a special place of humility as a former Diet Coke addict myself. I think there are a lot of things that are wrong with diet soda, and pregnancy is kind of like the least of the worries, frankly, of all of them. You know, I tell my patients that I don't expect perfection out of anyone. You know, I don't expect you to like be this angelic, perfect human who never eats or does anything bad. And, you know, a diet soda, you know, every couple of weeks, it's not a big deal. But diet soda as your only source of liquid throughout the day is not okay. Your teeth are not gonna like you, your belly is not gonna like you, your kidneys are not gonna like you. And so diet soda for me is one of those that I put in the kind of like sometimes food, okay for the occasional treat, but really we want you to drink more water than anything during pregnancy. And for my patients who are like very firm not water drinkers, and you know, I start slow, right? Like if you can, you know, every other drink a glass of water before you have a soda, or drink a glass of water before you have, you know, the juice or whatever, you know, beverage it is that you prefer. You know, just, you know, start doing what you can to increase your actual hydration, to increase your water intake, because we know that you feel bad when you're dehydrated, and diet soda doesn't do anything to actually hydrate your body.
No, and it also has caffeine in it, which doesn't help either, right, for pregnancy.
Right. Yeah.
All the acidity, the bubbles and stuff. So we definitely want to make sure that we're careful with that, because that not only affects the baby, but it does affect your teeth, the acidity. So even though it's diet soda, it still has acid in it. So
Yes, definitely.
all right, let's go to the next one. Losing a tooth during pregnancy is normal. No, it's never normal to lose
You're
a
an
tooth.
adult. No.
a loose tooth during a pregnancy, definitely not normal. So anytime anybody has anything happen in the oral cavity, whether it's a little bump that comes up, anything at all, the gums are bleeding, they didn't used to bleed them. There's a bump there, there didn't used to be a bump. Something sore, it didn't used to be sore. Anything that comes up anytime with anybody, but especially during pregnancy, get that checked out, because there's probably something going on with that pregnant mom's, her body anyway, and it is affecting the oral cavity. And as dentists, we should be a part of that team to help you get through that pregnancy in a healthy manner. So no, that is not true. Dr. Palmer, take this one.
This is one of my favorites. I have so many patients who are like, well, my granny told me that I can't lift my hands over my head because it's going to strangle the baby with the umbilical cord. And it is an old wives' tale that loves to get passed down from grannies, but it is completely false. I always say you're not a marionette with a puppet. Like, this is your arms are not connected to the umbilical cord at all. And so nothing that you do with your arms or your body is going to be able to, wrap the baby in the cord or put baby in danger at all. Exercising specifically is actually really good for you and baby throughout pregnancy. Women who exercise in pregnancy are going to labor easier. They're typically going to recover faster. We know that exercise at all sorts of levels of, mild to strenuous are safe. We don't have, back way in the day, we used to tell women to keep their heart rate below 140 when they exercise during pregnancy, but we have busted that myth as well. You can go as hard as your body is going to let you go as far as the intensity of your exercise is concerned. So anything that you could do before pregnancy, you can certainly continue to do during, and it's perfectly okay to start an exercise program during pregnancy. Just talk to your OB-GYN about what might be right for you. Listen to your body. If you feel like something's a little too much, then maybe dial back, but it is perfectly safe to lift weights, to run, to walk, to elliptical, to go to Zumba, to go to yoga, to do all of these things. And again, it's setting up good success and health for you and for baby.
So you're basically saying we can't use the pregnancy as an excuse.
Now, I will caveat that there are a couple of situations, like in pregnancy complications, that we may tell women to stop exercising, perhaps if they have a placenta previa, preeclampsia, things like that. So there are some circumstances where your doctor may tell you to kind of dial down your activity, but for the routine healthy pregnant person, not an excuse.
Yes, good one. And on that note, because I wanted to make sure that this was said at some point during our conversation tonight, was I did want to make sure that no matter what, pregnant women should always have an open communication with their OB-GYN and
Absolutely.
dentist.
Yeah.
Always tell us anything that you're doing, anything that you're changing. I know that dentists, when people come to dental appointments, they look at us like, why do you want the whole list of my medications? Like, you don't deal with my high blood pressure. You don't deal with all, but those medications do affect the oral cavity. And the medications that you may be on during pregnancy may change things also for the oral cavity. So, just thinking like that, always have open communication, no matter what, even if it's for good stuff like exercise. Talk with your doctors to make sure that everyone's on the same page and everyone feels good with it, right? If you don't talk about it, we don't know that maybe something's happening and we can't help you to be the best you as a pregnant mom. So make sure you have conversations.
Absolutely.
All right, Dr. Palmer, I'm gonna let you do this one too.
So I always remind people in the first trimester, your baby weighs like an ounce or two. And so when people go, oh, well, I'm eating for 2. No, you're eating for 1 plus an ounce of a baby. And even in the second trimester, your baby doesn't even weigh a pound yet. Their nutritional needs, they will take from you. So I always advise patients not to increase their calorie intake in the first trimester at all. In the second and third trimester, you need 200 to 300 more calories a day. 200 to 300 calories. That's like a yogurt.
Yeah.
That's a snack. That is one extra snack a day. So this is not, 6 full-size portions of meals throughout the day. This is one more snack from like a caloric intake standpoint. Now, women may feel the need to eat more often during pregnancy, and that's perfectly fine. Keeping your blood sugar stable, I always will recommend for women who tend to get really symptomatic from having a low blood sugar, you need to eat every 2 to 3 hours. Now, do you need a full meal every 2 to 3 hours? No. And so really transition your thinking away from breakfast, lunch, and dinner into eating kind of staggered little nutritious snacks throughout the day. And so no, you don't need twice the food. You just need your regular food in the first trimester, and then a couple hundred extra calories in the second and third. Oh, so I love this one because my mom told me forever and ever, her only 2 cavities in her whole life were during pregnancy because I stole her calcium from her teeth. So tell me about that.
Well, your mom maybe wanted to have the excuse out for that and why she got the cavities. But like Dr. Palmer just mentioned earlier, the pregnant mom, you're getting all the nutrients, and the baby will take take some nutrients from you. So what you do for yourself to keep you as healthy as possible is what's going to actually then turn around and also help the baby. Same with the calcium. And calcium isn't, we're not all of a sudden your body's going, ooh, the baby's going to take it all and you don't have any. No, but this is why you end up taking like prenatal vitamins and different things, because your body just needs a little extra, to help not only you through all this, but to also help the baby. Because, so it's not that you're taking the calcium necessarily, but it does help to have more calcium during pregnancy. So we definitely, the research shows that it's not necessarily true fact you lose calcium, like it's bad, but is it a fact that it does help you to be taking some more calcium during your pregnancy, just to help you to have the strength and to make sure that, because your baby's baby teeth are being developed during in utero, the baby teeth are forming, not the permanent teeth yet, but the baby teeth. So those baby teeth, it will help them to develop as healthy as possible. So what your OB-GYN gives you to help you support your nutritional, that vitamin intake is definitely what's going to be helpful. But it was your mom's snacking.
Absolutely.
Yes.
Oh, right. Okay.
Dr.
So
Palmer,
spicy
this
food.
is a big one. I know you hear a lot.
So patients come in, they go, well, I ate some pineapple and I still haven't had a baby, or I had Mexican food last night and I didn't go into labor. Why not? Because if that actually worked, we would not have to admit women to the hospital and give them Pitocin. I would just send them to Joe T's. Like, it's not, there's not actually a food that can make you go into labor. There's some weak evidence for things might soften your cervix, like evening primrose oil, but there's not even really great data on that. And the thing is, we don't have good data on a lot of like food and herbal nutritional interventions because they're not FDA regulated. We really don't have a way to study those things very well. But we do know that castor oil is a horrible idea. Only thing that's going to accomplish is give you awful diarrhea, and potentially give you metabolic acidosis. So do not drink castor oil. Let me, put you in the hospital and give you some Pitocin if you want to have a baby that bad. But castor oil is not a good idea. You can eat all the spicy food you want if that sounds good. You're probably gonna have some heartburn, but that's what Tums and Pepcid are for. But no, there is not a food or an herb or a pineapple or a curb walking or a mall walking or anything that's going to make you go into labor, except for just time. It happens when it wants to happen.
Dr. Palmer, I really hadn't heard this one. So what's up with this myth?
So petting cats is totally fine. What we recommend is that if you have a cat that is indoor and outdoor, that you have somebody else change their kitty litter. So there is a bacteria called listeriosis that can that outdoor cats can bring inside and then can come out with their waste. So, you know, this is I looked at it in my marriage as a really good opportunity for my husband and the cat to bond.
Let's clarify. It's more
It's
about
the litter.
the cat litter, right?
Right, exactly. Yes. And I always tell patients, if you don't have anybody else at home that can empty the litter box, well then, you know, just wash your hands. That's all you need to do. So.
And wear gloves, and you
Yeah.
can wear utility gloves or
Yeah.
you know, whatever else. So thank you for clarifying that. And because I do hear people, I hadn't really heard the petting the cat. I knew obviously about the cat litter thing, but that's good to clarify that. I think that's a good one that I've kind of heard in different ways. All right, Dr. Palmer, this one's yours too.
So as long as, again, your physician has not told you to be on pelvic rest for any reason, and those typically would be things like a placenta previa or maybe a subchorionic hemorrhage, if you've had some bleeding or if your water's broken. Those are the times that we do not want you to have sex, because not going to only hurt the baby, but it could hurt you, you know, physically, not so much, but like it could cause bleeding or infection that could be dangerous. But otherwise, during a normal routine healthy pregnancy, sex is perfectly fine as long as it feels good and pleasurable to you and it's something that you want to continue doing. You know, for some women in pregnancy, sex is like, you know, like there's a lot going on down there. I don't feel like it. For some women, sex is really great in pregnancy. So if it is for you and you want to do it, you can keep on keeping on until basically it's labor time, or if your physician tells you otherwise.
Good. I know that I've seen and hear that a lot. So thank you. I know it's kind of sometimes a tough conversation. So that's a good one to review. So we've kind of gone over some basic things that both Dr. Palmer and I kind of hear. Elaine's kind of heard as well with different things as going through this whole coordinated care for pregnant teens and women. So I haven't seen anything come in the chat box. Elaine, have you seen any other questions or myths come up?
Could I talk about one that I've had in my office lately?
Yes.
So there's a lot of myths going around right now about the COVID vaccine as it relates to fertility, as it relates to pregnancy. And let me just say for anybody who will listen that the COVID vaccine is safe if you are considering getting pregnant. It is safe if you are pregnant. It's safe if you just had a baby and you're breastfeeding. It does not have any negative impact on fertility in couples who are trying to get pregnant, either male or female. But we do have some evidence that COVID itself may cause some issues with erectile dysfunction in men. So there's a good reason to get vaccinated if you're a male. For women, again, there's been no increased risk of infertility that we've seen, and we have lots of data at this point. Everyone's like, oh, but it's so new, I just don't know. We know, actually, we have good data from, you know, hundreds of thousands of people at this point. So it is safe if you're trying to get pregnant. It is safe in pregnancy. We know that COVID itself is very dangerous in pregnancy. This is a virus that has a lot of really, you know, scary and weird side effects for a lot of people. We've seen blood clots go to the placenta and cause necrosis of the placenta in the 3rd trimester. We've had women had respiratory failure. We've had pregnant women die. We've had their babies die. This is not a joke, and it's not a drill, and it's not a hoax. And the vaccine is the one thing that we know that we can do to reduce your risk of severe disease, to reduce your risk of getting landed in the ICU. And we also know that moms who vaccinate during pregnancy, their babies are being born with antibodies. Those maternal antibodies are crossing the placenta and getting their babies protection. So you're not only protecting yourself, you're protecting your unborn kiddo. And in a time when we don't know when COVID vaccine, especially for the wee tiny babies, are going to be approved anytime soon, this is something that you can do as a pregnant mom to not only protect yourself, but to protect your kid.
Thank you, Dr. Palmer. Yay, I love it. That was definitely one thing that I wanted you to make sure that you discussed or brought up, because it is still, and I think will continue to be a question, a scare, and a little bit of anxiety for folks that are scared when they're not even pregnant, much less getting pregnant. And so thank you for that. And thank you for sharing what you've been seeing. And you're exactly right, what you just said earlier when you started your presentation, that, you know, you were starting to be able to look into patients' mouths. Now you're asking them, you know, masks back on. Our rate here in Tarrant County has gone back up to high census with COVID rates. So now more than ever, it's really, really important to get vaccinated. So thank you for that. Thank you for sharing your personal experience of what you're seeing on a professional level. I do see that it was asked if you would repeat, please, Dr. Palmer, if you would please repeat what the concern is with the kitty litter and changing of it when you are pregnant. Will you please?
Yeah, so there's a bacteria that, and again, if your cat's strictly indoors, it's not really a concern, but for cats that go in and outside, there's a bacteria called toxoplasmosis that can be in the stool that can, we know, like if you get toxoplasmosis as a pregnant person, it can cause some anemia in babies. It can cause things like heart failure in children, like in babies in the womb, as well as make mom sick. And so that's the reason to avoid the cat litter for an indoor-outdoor cat.
And as a reminder, it's not the kitty litter itself. It's the
poop
litter once they poop.
Exactly. Yes.
That you're changing the dirty kitty litter.
Yes.
That's what's important, not the actual just kitty litter.
Exactly. Yes. Sorry. That's
No
need to use the okay. Yes, it's the cat poop.
Gotcha. I just want to make sure that you said it correctly. I just wanted to make sure that it was understood that way from anybody who may be listening or watching, since the question was asked. So please ask any few more questions. If there's any, if you're thinking of anything, this is a great opportunity. You have the ear of a dentist and an OB-GYN. So please make sure, I've seen a couple of comments actually that were made in here that one is by a dentist and one is by another OB-GYN. So I love it. Elaine, while people are thinking, do they have any last minute questions? Is there anything that Dr. Palmer and I have not kind of touched upon tonight that you want to make sure we answer, or anything else, especially coming from what you hear from the Children's Oral Health Coalition?
Okay, thank you, Dr. Fuqua. One question I have for Dr. Palmer is pregnancy over? Are you done when you have the baby?
So pregnancy technically is, done once that placenta is delivered. But, by no means does that mean that your body is immediately back to normal. I think one thing that, and I'll get on a little bit of a soapbox about this, but that we do really poorly in this country is take care of our women after they have a baby. We have this kind of expectation that women are going to take their 6 weeks of maternity leave, 12 if you had a C-section, because we're going to be real generous there, and come back to work or come back to life and be like a normal human being when you haven't had a solid night's sleep and, weeks at this point, and your body is still changing. Oftentimes it's feeding another human being. You may still be bleeding every day. It's certainly not shaped the way that it was 9 months ago. And we have, I think a lot of unrealistic expectations that we put on moms to bounce back and to really kind of be back to your pre-baby body and, your pre-baby weight, and all of these false markers that we put on there with the, expectation of 6 weeks and you're good, you're back to normal now. And so, that's, I think a lot of, postpartum depression and anxiety can stem from that as well. And so I always try to prep my patients the best I can that this journey is not over at the 6 week mark, that it is, at a minimum, it took you 9 months to get somewhere. It's going to take you 9 months to get back, from just an expectation of when am I going to feel like myself again. Mm-hmm. And it is, it's definitely, a journey that is not over at 6 weeks, that's for sure.
Yes, thank you. Dr. Fuqua, there's a question. Someone had a mom ask about a baby being born with a tooth, and they were told those are not really teeth. What would you say regarding this concern?
Well, that is a rare thing, but it can happen. A baby can, it's called a neonatal tooth. So they can be born with a little tooth, and it is a tooth that develops and comes out, looks like a tooth, acts like a tooth. I would say if that happens, then that patient or the OB-GYN is probably seeing them first, and hopefully the pediatrician is getting them over to a pediatric dentist. A general dentist is not going to feel comfortable or want to deal with that at all. It would be a pediatric dentist. There are, most of the time, the tooth just stays there until it exfoliates, so it comes out when a baby tooth is developed and forms, the real baby tooth that's supposed to develop and form. But sometimes that tooth does need to be removed if it's very painful for the mom who's lactating. If that baby, if it's very uncomfortable and painful during lactation, then something can be addressed. Otherwise, it can stay, but it should be checked out because it's more on the rare side than it is on the normal side. But
yeah, I think I've seen it like once or twice maybe in 15 years. Yeah.
I mean, I've heard OB-GYNs that have said they've never ever seen it. So,
I know I've seen one because I went, oh my gosh, a natal tooth.
they're like, oh, that's something I learned in med school, but never really seen it. Yeah. So it does happen, but it is rare.
Yeah.
It is a real thing.
I lived.
Oh, go ahead.
I was going to say, I lived in an area where I won't say it was common because it is rare, but I ran into at least 3 moms that had happened to.
Oh, wow.
That's unusual. That to me
is
is
unusual. Yeah.
You feel like you've heard it a couple of times. Yeah. Very true.
So I have a couple of questions. Dr. Fuquay, this one's for you. What can you do when a dentist doesn't feel comfortable seeing pregnant people? How do you handle that as a dentist? Or if you're handling a dentist not comfortable with that?
If a dentist is not comfortable, the patient should be asking the dentist. If the dentist is downright telling the patient they don't feel comfortable seeing them because they're pregnant, then they need to ask them, would you feel comfortable if I get a clearance from my OB-GYN? Right? Because then a lot of the times, not all the time, but more times than not, then the dentist will go, okay, if I get clearance for the specific thing that we need to do, then I'll do it. Sometimes it's just they need a letter from the OB-GYN saying, yes, it is safe. Because all of a sudden the liability for anyone on the call, the liability for that dentist increases because they're concerned that if I touch the pregnant mom, it's not just about that one patient. I'm actually kind of treating 2 kind of per se, and they get a little extra nervous. So if there is a concern, the first thing I would say any patient to do is ask if they get a clearance from their OB-GYN, would they still feel comfortable seeing them? If they don't, that dentist still says, no, I still don't feel comfortable seeing, thank them for being honest, and then ask them for a referral. Ask them, then who would you recommend that I go see? Because if you as a patient feel comfortable with that dentist, but just now all of a sudden you're pregnant, ask them for a referral. They should, by law, they should be giving you at least some names of where to go and referring you to.
Yeah, and as an OB-GYN, we all have a form letter that we can print out from your chart saying it is okay to do dental work with x-rays. I noticed a question in the chat, lidocaine with or without epi is completely fine, whatever is your preference from a dental provider standpoint. Yes, and so we all have that form letter that we can shoot out and give to patients. That is, easy for us to do, for sure.
Yes.
Dr. Palmer, let me ask you this too, because you and I talked about normal occurrences after delivery. So after delivery, what are some things that a teen or woman need to be aware of that would be a cause for concern? That is a normal occurrence, but they may not know that that's normal for them.
From like a mom standpoint, bleeding is very normal, like period type bleeding for up to 6 weeks and sometimes longer for some women. From a like a pregnancy resolution standpoint, like your swelling does not immediately go away. That's going to take some time. Your uterus takes time to kind of return back to its normal size. It is normal not to fit back into your pre-pregnancy clothes, the day that you leave the hospital or several weeks thereafter. If you're breastfeeding, there's a lot of normal breast changes that go on with engorgement, and not normal is a fever, not normal is hot red spots. But there's definitely a bunch of things. It's just like during pregnancy, there's a bunch of things you go, well, this certainly can't be okay. My ribs are hurting and my pubic bone feels like it's pulling into, and I feel like I'm bruised on the inside from my baby moving around so much. I go, oh, well, no, that's kind of normal. So there's a lot of it's just reversing basically everything that happened in pregnancy. So it's definitely a process that, again, just takes some time to regroup. It's very normal also to have like a lot of emotional adjustment to bringing home your first baby. I always tell patients, your life that will never change as much as it does the moment you have your first kid. Like that is the biggest life change you'll ever have, going from 0 to 1. When you add another kid or 2 or 3, or you lose your parents, like there's so many life changes that go on, but nothing will ever change you as much as having your first baby.
Right.
And so it's a lot to process and a lot to kind of emotionally work through. Hormones are big. Moods are swinging and wide, and
Yeah.
it is definitely a time that any support that you have, you can call on it, you take it. If somebody offers to do your laundry or watch your kiddo or clean your kitchen, like let them do the things, because that doesn't last forever. And I always tell patients, if somebody's offering to help you, it's not because they think that you can't do it, it's because they've been there and they know how much you need it.
So let me ask this question to both of you, because I know we're winding down to our time.
Yes.
We talk about the support of the dads and the support system that pregnant teens and mom have during this journey. And I think from dental or medical, I would be curious to hear what y'all's your thought around what you've seen and how valuable that support was and how it has helped them on their journey.
Go ahead, Dr. Palmer.
Yeah, don't y'all fight over that question.
I think it's a great thing. I think you see more nowadays, though. I think you see more support from fathers. There are more and more fathers even staying home to care for children and giving up their careers, where a mom does want to go back and wants to be full-blown in careers. So I see that a lot of that helps. And the other thing I see too is I've never had as much conversation with mothers and family members as I have in most recent years of practicing dentistry, because it's taking a village again to raise a child. So you've got grandparents kind of babysitting, you've got aunts or uncles, or you've got a older sibling helping taking care of a very the younger one, to mom or dad. And so all of a sudden there's a lot of people caring for maybe not necessarily an infant, but as they get a little bit bigger and need to have daycare or just care in general. It does take the village, and I see more hands are helping to support that baby or that child to raise them. And for those reasons alone, we need to have conversations with external, it's not just mom anymore. It's the support system that's required, just because we live in a very crazy, busy, go world. And our cell phones and the whole idea of being available at all times for anything and everything just adds added stress to our world. So that's my take on it. And I really think that it's not just a conversation. This is the peak start of the conversation about pregnancy, because it's about the whole family unit that helps raise that baby, right? So that's my perspective.
Yeah.
Yes.
And, I think it's a lot of adjustment too. Again, as much as a mom's life will never be the same, that's true for dad. You go from being a couple that really only has to think about each other to having this like new very, very needy person that is demanding a lot of attention and effort from both of you. And, you know, I do think that, again, our country does this pretty poorly about paternity leave and, you know, giving men the time, or even same-sex spouses, like giving parental leave when you are not the person carrying the baby. We're not good at that in this country. And so, you know, anything that we can do to help support, you know, families, like I will fill out that FMLA paper. Like if he can take their leave or your partner can take the leave, I am there to support that with them. You know, I tell my moms, especially those who are really feeling the burden of like, I feel like I'm doing it all myself. I feel like I'm breastfeeding. Nobody can help me. I always tell them your partner wants to help. Like they are there staring at you going, what can I do? And they may not see what needs to be done or what you feel needs to be done. So just having a really direct communication and really honest conversations of, you know, right now I feel like all I need to be doing is feeding the baby, but if you could fold the laundry, that would be really helpful, because they're not seeing the laundry in the dryer because they probably didn't put it there. And so you have to tell them very specifically what you need them to do sometimes. But just again, like taking that help from extended family when it's offered. And it's not because they don't trust you to do it. It's not that they don't think you're capable, but they know how hard it is. And so, yeah, just relying on that village and letting them help you when help is offered.
Yeah. Elaine, I want to make sure Dr. Palmer and I, because we both have discussed this in conversations in the past, and I just want to make sure that we get these two things covered. And then there's two other questions, and then we may need to end up wrapping it up. But two things, Dr. Palmer: nitrous oxide.
Oh, yes.
Known as laughing gas.
Yes.
Patients are typically nervous to go to the dentist to begin with. And now you're pregnant and you already are a scared dental patient, or maybe a dental phobic. And now you're pregnant and you're scared to do anything wrong for the baby. So then there's an added stress component to all that. I know the answer, Dr. Palmer, but since you're the OB-GYN, is it safe for a pregnant woman to have nitrous oxide during pregnancy?
So this is one of those things that we want to try to avoid in the first trimester. But in the third trimester or the second trimester, nitrous oxide is completely safe. We give nitrous oxide to pregnant women in labor for pain relief, just like you guys do. And so there is some association with increased risk for miscarriage in the first trimester. So I would encourage an alternative solution at that point. But second and third trimester, there's no concern there.
Good. Thank you.
And no concern for pregnant dental workers with the current like scavenger systems that everybody uses. There's no concern there. And that's where actually the original data came from, back before scavenging systems were really you know, widely used. We saw increased incidence of miscarriage in dental workers in the industry before, like around these really high concentrations of nitric oxide. So that's where we get the data. We don't have data about, is a one-time use during a dental procedure okay? When there's other options, it's just not worth it. But, you know, again, second, third trimester, totally okay.
And of course, again, conversations with your provider, always making sure you let them know if you are nervous, and maybe if the patient is nervous not only just as a dental phobic, but now you're pregnant and that adds another level of anxiety. Maybe it's just the injection. Maybe that's what you're nervous about. Right. So maybe even just having the nitrous, I've done this many times, to just get the patient through the injection. Once they're numb, they're like, you can drill and fill all day long or do whatever you want, they're fine. So sometimes, again, just talking to your provider, physicians, dentists, nurses, healthcare providers cannot help you if you are not being open and honest about your concerns or your fears. So please make sure that you are asking questions and letting them know how you feel. Next one, and then we'll move on to breastfeeding. Again, questions were asked in here about epinephrine, if you can give a certain local anesthetic or anesthetic with epinephrine in it. And then people will end up asking, should I pump and dump that first after a dental procedure, or what should I do when I'm breastfeeding and I've had a dental procedure?
Yes, so zero need to pump and dump after a routine dental procedure at all. And so even with like general anesthesia, frankly, at this point in time, if you are awake enough to feed your baby, you do not need to dump your milk. And so, you know, I wouldn't actively nurse a baby when you're under general anesthesia, but that's not a thing that happens anyway. So, no, routine dental things, you do not need to waste that precious, precious breast milk. Don't do that.
Okay, perfect. Thank you. I know those were two big things I did want to make sure we're covered. I thought maybe some questions would be asked, but that since it didn't, I want to make sure we covered it. Elaine, do you want to go through these, just a couple of questions about, is it true that bending over too much during pregnancy can cause the baby to have jaundice?
I had never heard that one, and no, that's not true at all, but that's a good one.
Yeah.
Oh, and then let's see, I think there was another third trimester. Should mom be elevated on the left side during dental treatment?
Yes, so we do recommend for more maternal comfort than anything that after 20 weeks, mom needs to be on a little bit of a tilt in the office. So you could encourage your pregnant people to bring like a small pillow with them, or they could roll up their jacket and put it underneath one hip. We just need about 15 degrees tilt. This does not have to be like a full on their side experience. If they're uncomfortable, allowing them to, flip it from side to side, the right tilt is just as fine as the left tilt. But once the gravid uterus gets up to the belly button around 20 weeks, that can compress the vena cava, which can compress diminish venous return to the heart and cardiac outflow. So they may get lightheaded or dizzy if they're laying flat on their back for a prolonged period of time. So yeah, just a little tilt after 20 weeks and they'll be just fine.
Yes, comfort items. And then from the dental perspective, as a dentist, there are times that I will do stand-up dentistry and allow the patient to be somewhat elevated in the chair and not laying back. Because in dentistry, you already feel like you're upside down and backwards. As a patient, that does not help when you're, especially in that third trimester, when you really have that extra weight and stuff. It's just uncomfortable. And so Dr. Palmer said, I'll reiterate, comfort items, as well as maybe keeping them elevated more than you would back, really tends to help our patients a lot with that. So those were some great questions tonight. Thank you. Oh my gosh, I appreciate the information starting to come in the chat. I hope that this information was helpful. I'm gonna let Elaine wrap it up, but Dr. Palmer, thank you so much for your time.
You're welcome. This was so fun.
Who would have thought an OB-GYN and dentist would, be having these conversations, but we're grateful and thankful that you are, and you are a pioneer in our area. In our state of Texas. I hope people that are hearing this today understand fully that Dr. Palmer is one of the few OB-GYNs that we have seen and heard of. And this is even not just coming from me, but coming from the Department of State Health Services in our state of Texas, saying that what are y'all doing here? You're doing something right. And this is where it starts. Grassroots efforts, starting to reach out into the community. So thank you. Thank you. And
thank you for all the work you do.
Well, I appreciate it. And I thank you, Elaine, for being diligent and continuing to keep this conversation up and high at a level that and just continuing to make sure that people are hearing this information in any way, form, or fashion. You are doing an awesome job at that, and I appreciate it.
And I want to let my participants know we have another session coming up on August the 23rd. We are going to talk about community resources. The first one, part 1, will be about medical, dental, low, no-cost resources in the community. We will also talk about emergency, going to the emergency room, what constitutes an emergency, what you can do for home emergencies. We'll also talk about financial resources available to help out children and the kids, but just to kind of help you more with that piece. And then part 2 will be in September,